Good evening. I'm Larry Parrish, the Executive Director for the Shine CDC, and welcome to our very special V Talk tonight. Shine stands for Sharing Hope in a Negative Experience. Our scripture for Shine is Matthew 5:16. Let your light shine before others that they may see your good deeds and glorify your Father in heaven. So I'm going to go ahead and lead us in prayer. Father God, we thank you, we praise you, we magnify you. We thank you for this very special V Talk, Lord. We thank you for our pastor, Dr. Jazz, Lord. We thank you for our speakers tonight, Lord. We thank you for the IT folks tonight, but more importantly, we thank you for the knowledge that will be shared and the lives that will be changed. We give you the praise, we give you the glory, we give you the honor. In Jesus' name we pray, amen and amen. All right, so we've got this very special V Talk tonight. I'm going to turn it over to Dr. Jackie Nicholson, and then she's going to introduce the speaker for tonight. We all know what's happening with the new variants around COVID-19, kids getting ready to go back to school. They're talking about the federal government. They're going to put a mandate that you get the virus. So we're going to try to answer all those questions for you tonight. I'm going to turn it over now to Dr. Jackie Nicholson.
Thank you, Deacon Larry. Yes, as Deacon Larry just mentioned, we are here to continue our talks with Dr. Sharon. Dr. Sharon is our guest resident doctor who keeps us in the know of all things health that are going on in the world. And she has been giving us all the information that we've needed since the beginning of this pandemic. And now she's coming tonight with some updates on all the new variants that we keep hearing about in the news. Dr. Sharon, as you know, is a health strategist. She's a consultant. She's a physician, a health educator, a speaker, an author, and she's the director of a nonprofit organization. Dr. Sharon, thank you so much for coming back with us tonight. And we are ready to learn, because that is why you're here, to educate us and to help us understand more about what the news is telling us. You know, if we don't have a science background, we don't really know what they're talking about. So I know you always keep it real and you break things down for us. So just going over some of the stats, right? As of this week, we have in the United States over 35 million cases of COVID, right, to date. There are about 53,000 new cases, approximately 628,000 deaths from COVID, and majority of those are in people who are unvaccinated. And we have right now roughly about 47.6% of the population has been vaccinated. And we know that there's a lot of new variants, right? They're all with the Greek alphabet. From Alpha was the first one, which you told me earlier offline that's almost gone. But now we have the Delta variant, right? And that Delta variant, as we see, is spiking the numbers up. Why is the Delta variant like more of a problem than the Alpha one?
Well, thank you all for having me again. I was off camera trying to get my mama on, so hopefully she is on. This is a very serious discussion. I want to hit those stats, but I want to start with it ain't over. We have somehow in America thought that it's over. It is not over. COVID is not over. Okay. And so what has happened is, yes, we got hit hard over a year ago with COVID, the original strain of COVID. Well, what happens with the virus is viruses want to live just like we want to live, right? And so viruses they have to be in someone to live for long term. And so when they find out, oh, this person is vaccinated, let me change a little bit. And now that's the variant. That's all. Let me come at them a different way. That's all it is. That's like a thief trying to break into your house. The front door is locked. They may try that. Well, but you got a window on the backside that's open. I'm coming in the window and I'm coming and using other tools to get in. And I am stronger because I have now adapted to the environment and I'm stronger. And that's all the variants are, no matter what we call them. So the Delta variant is easily transmitted. So it's stronger. It's easier to get, if we want to put it like that. And we're seeing that there are even more complications with the Delta variant. And that's why we're seeing the spike. Persons that have been vaccinated have protection. But remember, even back when we first started talking, Dr. Jackie, I said, the vaccine does not mean 100% you will not get COVID. It means that you will decrease your risk of being in the hospital and of dying of COVID. And just as you said, the deaths and the adverse effects that we are seeing now are from unvaccinated folk.
So is it safe to say that we keep getting the different variants because of the unvaccinated people as well? Is it
That's
because
a huge part of it.
okay?
Because we can't get to herd immunity until we hit a certain number of vaccinated. And so people sitting at home telling me, I don't want to put nothing foreign in my body. I don't want to do whatever. It's political. It's not. And please, y'all, stop blaming Trump folks only, because you have young, middle age African Americans and Latinos that are saying they can smoke all the weed they want, but they cannot put something foreign in their body. And that's crazy because they also have the younger kids, which we're going to talk about later.
Yes. So I know you said with the Delta variant, there's been some adverse effects that we haven't seen in the previous variant. Are the symptoms different?
Oh, no. The symptoms are basically the same. You just you need less of the virus to be sicker.
Oh,
okay.
Yeah.
Just more sophisticated. It has come back harder and it's come back better as a virus is concerned. And the way we end this pandemic is, COVID is preventable. This is a preventable disease. Get vaccinated. Right. It's preventable.
Yeah, you say that.
Rocket science.
Right. You say that on this week on Facebook, I'm just looking at people's different posts. And one of the posts was got polio. And it was like, me neither. Thanks science. And they listed all the vaccines that we don't have. So COVID should be in that list. And hopefully one day we'll get it. Yeah. Tetanus,
measles, mumps, rubella, all of those. Again, vaccines save lives every day. And then in America, we have gotten, and I'm American, so I'm gonna talk about us. There are people in India that would love to be vaccinated. I mean, it's India, different parts of the world that are waiting on vaccines. And our CVS and Walgreens hospital, everybody and their mama got vaccines. And we're starting to shut down some of the vaccine administration places because people aren't going.
Yeah. So I mean, I do find that very interesting how we started, it seemed like, it looked like everyone was going. And then once from everyone, they took off the limits of who could get it first. Once they took that off, nobody went. Like you said, they're going door to door. I know in the DMV area, they're going door to door trying to get people to get themselves vaccinated. What do you think is keeping people back from wanting to get vaccinated still? I mean, because again, we see the numbers of deaths. So why? Do you have an answer for that?
I used to be nice when I was doing all these COVID interviews. Now I'm just straight no chaser. Ignorance. You trust Bubba, who failed high school biology, over your doctor. All right? You trust Bubba over Dr. Fauci and all that. And then you got all these conspiracy theories. And then what kills me is people that look like me talking about, they're trying to take out the race and all. We ain't got to do much to take. Look at who's shooting who. Okay, let's talk about that. Let's talk about other forms of genocide. And there is absolutely no evidence to back this foolishness. You're going to be magnetized. All this stuff. And again, it's a vaccine, just like polio vaccine. Just like
that's what I was going to ask you. What are the numbers? What are the numbers for those who have died just from getting the vaccine? We're not talking about if they got COVID again, just from getting the vaccine. Okay, that's what I saw. I just wanted to make sure my research was right. Okay, so yeah, all right, so yeah, because again, like you said, you've heard about the magnetized. I've heard about the different ingredients, and not. But again, I was like, well, do you read all the ingredients on the over-the-counter medicine or the medicine that the doctors give you? So
I did a radio interview.
Mm-hmm.
A weed smoker every day talk about it was gonna help him with COVID. I said, well, do you go to where do you go get it? Well, so-and-so on the street. So you got trust that over a FDA approved for emergency use
Right.
vaccine. So don't talk to me with that craziness. Don't talk to me. You go to Popeyes and all this other stuff with these big chicken. You know, a chicken breast ain't never been that big in its life. And you know that they're getting pumped up with steroids and you eating it. So let's not talk about that. Because at some point you have to save your life and the life of your family. And this is the point I want to talk about, Dr. Jackie. Children under 12 cannot get vaccinated. Not yet. Hopefully in a few days, few weeks, yes. But a mother and father that are unvaccinated, you are putting your children at risk if you transmit to them. Of course they can transmit to you, but you're putting your kids at risk. And yes, we have children and young adults that have died or have major complications. There's a 24-year-old that had a double lung transplant at 24, previously fully healthy, that had to have double because of COVID. So we have to be aggressive. And in our communities, we have to jump up and down and spin on our head and say it like it's real, because it is. You need to get vaccinated for all of us. And you don't need, I'm gonna tell you now, if you're in Kannapolis, North Carolina, don't go to my mama's house if you're not vaccinated. She's vaccinated. Do not be around my people if you're not vaccinated. Sorry.
Yeah. No, that's real. I had last week 2 family members, a mother, daughter passed from COVID, and another daughter that she's in ICU. So, and again, this is down south. They're just, again, some of the people are just still not willing, and they went around her and she was elderly. So, that was, it's just sad because you keep hearing these things happening. And the people don't take into consideration going around the elderly or people who have major health conditions when they're not vaccinated.
And, I have to give a shout out to Dr. Jazz. From the beginning, Victory, Grace, and Shine, you all have been at the forefront of talking about COVID from a realistic, factual standpoint, but you have pastors in their pulpits saying that God is going to take care of me, and you don't have to get vaccinated. And often they end up with members in the hospital or dead, but don't nobody come back up in the pulpit and be like, oops, my bad, I shouldn't have told you that. You should leave those decisions to people that went to a school somewhere with some science background and trust the science. And, Dr. Jackie, I say this all the time, whether I'm talking about cancer, I'm talking about COVID, I'm talking about anything. I am a born again believer. I am. And I know that all healing comes from God. All. The vaccine came from God above, right? Yeah. All of them. And so how dare we tell God what you're giving us to save lives? Your healing mechanism is not good enough for me and my family. I want you to divinely build a wall of protection around me. And God is sitting there saying, fool, I gave you 3 vaccines right now in America. And what else you want me to do? Right.
Free. Yeah. Well, you said possibly within the next couple of days or so, we may have, I know the FDA is being pushed for the vaccine for children, 5 to 11. So I know they're trying to extend the trial so that we can see. I know one of the concerns that I saw was more or less about the pericarditis or inflammation around the heart that they saw in some of the.
Yes.
So I know that was one of the things that they're trying to see how many children it's affecting. So so I know you said possibly we could see this before school opens.
Well, Dr. Fauci actually said that he's looking for certainly before school opens or in the first months of schools being opening, but there is a mandate, and I did write down something he said, that there is a mandate that the CDC is pushing, and we need to talk about the new CDC push. There's a mandate that they would want children to be in masks in the schools. But according to Dr. Fauci, and I think this was today or yesterday, children as young as 4 years old would likely be able to be vaccinated by the time we reach the end of the calendar year 2021. At worst case scenario, first quarter 2022. But we do believe that 6-year-olds, those that are school age children, prayerfully the FDA, and the data is looking great coming out, and it's been going on for months and months and months and months, the clinical trial in children, and that is looking very good. But just know anyone with kids 12 years and older can be vaccinated right now. 12 years of it. So your little ragamuffin that's 12, just turned 12 at that 12-year-old birthday party, have a vaccine party.
Yeah. No, I agree with that. My youngest is 11. So as soon as we, get the okay for that, because he's the only one in the house. Everybody else, my 16-year-old, he's like, when am I getting my shot? He's concerned. He's like, when am I getting my shot? So, so in the event, again, if it's available by the time I go to school, the people who are vaccinated and they feel comfortable, they'll get their children vaccinated. But again, there's still going to be a great number that does not. What do you think are going to be the precautions that are besides the mask in school? Do you think it's going to, because the numbers are going up, do you think it's going to have us going back to doing virtual, or?
We may. I mean, we have to see really how Delta and the other variants are going to shake out, but we're seeing an increase even in Maryland. 90% of the cases are in the unvaccinated, but not in Maryland, 309 new cases in the last few days. And we have in Maryland, we're doing pretty good. I think we're number 4. Don't quote me on that, but we're in the top 10 as far as vaccinated, with over 3.54 million Marylanders vaccinated. But we still have work to do, because guess which counties have the lower rates? Some of the rural counties, but also Baltimore and the Prince George's County.
Wow.
So what that look like? I'm just asking.
Yeah.
And so we cannot just say, because this is what I'm getting a lot on other interviews and questions. We cannot just say that these are the Trump states that are bad.
Right.
Yes, we know that the red states have a problem. We know that Alabama has a problem, Tennessee, even West Virginia, there is a problem, and this has gotten political, and people just have lost their mind and all that. And that's why, certain groups and political parties are coming out now saying, oh, get the vaccine, because your voters are dying off. But it's important for us to have grace and mercy. And even on those persons that your family members in those areas that may have these beliefs, don't stop pushing them to get vaccinated.
Yeah, that's definitely, these conversations we're having every day. All right, so with the being fully vaccinated, right? So they're talking about now some breakthrough infections.
Oh, yeah.
Fully vaccinated.
Yes, and we always knew it. I mean, again, when in our first discussion, I've said over and over again, the vaccine does not mean that you will not get COVID.
Right.
It means that your risk of hospitalization and death are dramatically reduced. Now, we do need to talk about, there's what the CDC says, and now the CDC has of yesterday, I believe it said, we in high-risk areas, go back to the mask and be outside as much as possible, social distance. Let me tell you what Dr. Sharon is doing. The mask has never left. The mask, socially distance, wash your hands, have your disinfectant, and just be fully with the full armor against COVID. Even though I am vaccinated, and we're still going to wait and see. And there's data out today that I think is public that Pfizer's vaccine and the others are going to follow are showing great increase in protection with the booster shot. This is not official, but do not be alarmed or surprised. And we talked about this before. If a booster shot, a third shot, or in Johnson & Johnson's case, a second shot of any of the vaccines will be promoted in the fall. And please, for the love of the Lord and everybody else, get your flu vaccine this fall as well.
Okay. So you brought the booster shot. So you said probably in the fall. So what are the guidelines for that? I know
do not have them public.
Oh, they don't have it yet. Okay. So we'll bring it back.
They've not been announced yet, but they're in clinical trials right now, and the trials are looking great.
Okay.
And we have to say this, Dr. Jackie, because this is what's happening, particularly in some communities. Oh, the vaccine was too fast. Oh, it's experimental and all that. This is the most highly studied, tested vaccine and one of the medications in the history of the world.
Right. Yeah.
So with that technology, we have now individuals going to the moon, right? Individuals.
Right. Individuals, yes.
Nobody said, I mean,
Questioning how's that happening?
yes, we can pick and choose. This is a vaccine that the world came up with, the world's leading scientists, and this is a variation of a vaccine that we had with SARS. I mean, COVID is a virus that we've seen before, just we saw the sister. Then the brother has come out.
Yeah. I always find that interesting. I'm like, oh, so you went to medical school, so you had epidemiology, so you studied the course of how long it takes vaccines. Of course, back then, they didn't have the technology that we have. The technology we have is so far advanced that if they did not come up within the time they did, that would have probably been a problem. So, Dr. Sharon, I'm 100% definitely behind everything that you're saying. I mean, I see it.
I mean, people challenge you all the time. I mean, I'm just like,
all the time, all the time, yes. so I'm just like, okay. I mean, sometimes, but again, you have to keep, you can't stop the conversation. I still have to try to explain.
Yes.
The facts.
Questions. I want people, even watching now, if you hear a rumor or you think, well, maybe it is going to be a magnet, ask the question, please, right. But also seek credible resources. So your cousin's baby mama twice removed, maybe, is not necessarily a credible resource, and they're going to give you some herbs to try to stave off whatever. Again, credible, go to cdc.gov, NIH, go to World Health Organization, all of those. And then, Dr. Jackie, we have one more thing I want to just make sure we hit on, because they're saying, oh, things are changing all the time. This is a pandemic. We're learning more all the time. And so I'm just going to wait. Okay, keep waiting. You'll be like the 24-year-old that had the double transplant. Or, and then our children, we have childhood deaths now. The 6-year-old boy that died did not, and it is a lot on the internet that he had pre-existing conditions. No, he did not. He did not. Right.
So with that and the children out here, because right now it's summertime, people, again, like you said, thought the pandemic was over. No, the quarantine part for the whole world, for the United States, I say, was over, but not the pandemic. That's still happening. So, but we have our summer camps going. So what are I know you went over the measures of what we should do. What should parents do that still want to, that are sending their kids to camp, but are still kind of like, should I pull them out, or what should I do since the Delta variant?
Find out what the protocols are. Find out what the camp instructors, are they vaccinated or not? What are the protocols? What measures are they taking? Are they social distancing if possible? We do know still, and I don't want to give wrong information, we do know still that children are less ill than our elderly or even our middle-aged persons with COVID. But what are the protocols, and what happens if somebody pops positive? Do you shut things down? What is it that you do? You ask all of those questions. And then this is a interview with me on a faith. Victory Grace is faith, and Shine is a faith-based ministry. And so, number one, pray about it and have peace about it. Our children have been in for a year. I mean, I know I'm ready for another vacation. But again, mask, hand washing, and what are the protocols that are there?
Okay. All right. So let me see if we have any questions, I believe. Let's see if we had any questions from Facebook or YouTube. You covered everything. We've gone over COVID many times, and that now we're just still pushing the education and why you need to get vaccinated.
Yeah.
So I have a question. Is it fear or is it will? Because we know in the African American community, there's a lot of fear. But is it fear, Dr. Sharon, or is it the will? Because we want to save our community. So how would you elaborate a little bit on that? Because I've talked to a lot of people that are not vaccinated. I am. My daughter's mom and I, we decided that we're going to get our 16-year-old. She and I did it together. So we went up through the whole process, got the first shot, got the second shot together, and it went very well. But I think there's a lot of fear in the community. What can you share with our community? Because we want to save them.
I want us to be a little bit afraid of COVID, and what happens if you get COVID and you're a little bit overweight, you have diabetes, you have hypertension, you have heart disease, which is rampant in our community, or you have lupus. And I want to make sure that we understand that COVID is not just you get a little virus and you get over it. We now know long-term effects of COVID include damage to the heart, lungs, kidneys, brain, and other organs. People are reporting mental health fog or COVID fog, not able to remember as well. We don't know long-term what the virus is going to do and how it's going to show up, but we know that there are some lingering effects of COVID. So I want us to be, a little bit afraid enough so that we go sit down and say, okay, vaccine or COVID, which is the greatest risk to my health? The health of my family. Certainly, COVID is a bigger risk. Now, I want us to have a healthy skepticism of any medication, but I want you to use the same barometer that you use with the vaccine for COVID that you use for those French fries that you're not supposed to eat because you got high cholesterol and hypertension. Because our risk of death is still heart disease. So we've gotten it twisted. So now, I want you to be skeptic, a healthy skeptic. So go to the CDC site, go to the FDA site, learn what you can, talk to people who've been vaccinated, but ultimately don't wait too long. Go ahead and get vaccinated for you and your family. And I want you to be skeptical about even childhood vaccinations. Now, I am saying, yes, over 12, please go get vaccinated. But check it out, talk to the pediatrician, make sure, and you make a conscientious decision, but not one of foolishness and the latest internet rumor that's out there.
Great. We do have some questions coming in from Facebook. So if you have questions, please just post it in Facebook and we'll get them answered where we got the expert here. The first question comes from Deacon Antoinette, and she says, will there be other variances coming down the pipe?
Oh, there already are. There's a beta variant, there's a lambda variant, yes, and there's delta, and lambda is here. So yes, there are variants. Again, a variant just means I tried to get in the front door, that didn't work. I'm gonna go in the back door or the side, and I'm gonna change myself so I'm stronger to punch through. Variants are very, very scary, if you will, because variants come back stronger. They come back harder because they're smarter viruses.
So we had one question come in, like they're saying now that the federal government, if you work for the federal government, they're mandate that you get the vaccine. What's your thought around that? Because a lot of people got a lot of issues around that.
Well, number one, the mandate that came down today is that federal employees are going to have to wear masks. That's the mandate. Okay. Now, the mandate that probably will come down when we have full approval by the FDA is that it will be mandatory. And this is what I believe. Because healthcare professionals right now, I think there are over 60 medical organizations that have signed on to this. Hospitals, medical organizations have said, yeah, you can't work here if you're not vaccinated. And it was a big hoopla, people crying, oh, whatever. How is a nurse or a doctor going to be crying because they have to get a vaccine and it actually is going to protect them, right? And so it's just like anything else. If you work for the feds and you have a felony, you want to apply for a job and you have a recent felony, guess what? You can't apply. If you are a healthcare professional and you work for a hospital and they say you have to have MMR or polio, whatever, guess what? You can't work, you have a choice. That's what I want to address. You have a choice. So if the feds come down and say you got to be vaccinated, you can have a choice. Get your pen out, write, I resign, and you go sit in your house and chant. But it has an employee. There are that's like a truck driver saying, I don't want a license. Okay, then you can't drive trucks.
Very good. Very good. Wow, the questions are really coming in. I'll take this one and then I'll let Dr. Jackie take the next one. This one comes from Brian. Do people that have had COVID and are now vaccinated now fighting with a better immune system against the virus?
I love this question. Number one, you had COVID. The studies now, and there's a long-term study to see how long you would have self-protection, your own protection against COVID. All right, we're kind of landing at about 90 days. It's still out there. Some people longer, some people shorter. But the studies show that the person that has natural immunity because they had COVID is not going to have consistent immunity. That's why you still need to get vaccinated, even if you've had COVID, because your immunity is up and then it goes down. With the vaccine, it is, again, artificially produced vaccine that has a footprint that will last longer. And right now we're almost at a year with that footprint. So now, but the question is valid. If you have COVID, you have antibodies to COVID, then you get vaccinated, you get more antibodies to COVID. So for a shorter period of time, yeah, you've almost given yourself a booster. You get it? You've almost given yourself a booster because you've been exposed and now you've been exposed again. Now, the other part is, let me tell the truth and shame the devil. You can get COVID twice. Okay? Get vaccinated. You can get COVID twice. And think about it. If you get hit twice and you get hit from the back twice, you're probably going to have some longer term effects, right? That's just common sense. So so people walking around saying, I had COVID, so I don't need to get vaccinated. Okay. Have you had Delta? Have you had Lambda? We're going to see what happens. Y'all know I'm crazy and I do like to answer the question. You don't understand, I'll break it down even further.
No, but no, that makes a lot of sense because again, if the variants keep changing, it's a new. You didn't have this one. You might have had the last one, but you didn't have this one.
And how do we stop the variants as a nation? Get vaccinated because they will die out. If they don't have persons to go into, they die out. That's what we need.
Right. Yeah. And like get fully vaccinated.
Yes. And don't miss the second shot.
Yes. They're missing the second shot.
Stimulus check. You did not.
And I've heard of people coming down with COVID after that first shot because they didn't go get the second. So it's like you have to follow the protocol.
Again, you did not miss that second stimulus check, did you?
Oh.
Don't miss the second.
Most definitely not. So are people of color still at higher risk than the other races for COVID?
Yeah. Because we have a lot of comorbidities, more hospitalizations, less access to healthcare, and you also have this segment of somebody put in the chat, our community that's putting these falsehoods out. And I want to say that there is now a thought. People talk about racism and the vaccine is racist. There are also bots that are targeting young African Americans with misinformation about COVID. So y'all talking about conspiracy theories on the other side. There is now targeting of minority populations about COVID to keep you from getting the vaccine.
Yeah.
But y'all want to talk about fight the power. Okay,
yes.
Power is giving you information and then you become the carrier of the information.
Right. Oh my goodness. So question, I know this was something early on we didn't know for sure yet about if you're fully vaccinated, can you still transmit it, the virus?
If you are one of the breakthrough, they're now studying that. So it
Okay.
will be, number one, much less that you will get the virus. But once you get the virus, they are still studying, and that's still up in the air as far as I know, and the latest reports that I've seen and calls I've been on if we can categorically say yes or no. Assume yes, because you have gotten a breakthrough, you could possibly transmit. But even those that get the breakthrough, that you've been vaccinated and you get exposed to COVID and you get very mild symptoms, well, you have a low viral load. You have a low amount, right, that has been able to come in. And so that also inhibits your ability to transmit.
So if
Does that
someone
make
gets COVID, it does, yeah, it makes a lot of sense. So if someone gets COVID, I know the guidelines changed for the quarantine. What is the quarantine now if you get COVID?
Right. If you're vaccinated, you are not going to have to quarantine if you've been exposed to
Okay.
COVID. So if I'm vaccinated, I don't have to quarantine. But I need you to also check the states, because the states are doing their own thing. So check the state guidelines as well as the CDC guidelines. And then also, I do want to give a shout out, and this is important. If you are vaccinated, do not think that you cannot get COVID. And so if you start to get symptoms, you need to be tested for COVID. Okay, don't say, well, I don't need to get tested, I already got vaccinated. No, you need to get tested. That's how we know that you may have been exposed again.
Okay, so the guidelines for quarantine, if you have changed by is no longer federal thing of saying 14 days. Now you got to check it.
Right.
Okay.
Right.
Okay.
And I do want to just stress what you said earlier. We are getting COVID. We are dying more of COVID as minority populations, non-Black, non-Hispanic Black, so Blacks and Latinos or Hispanics. And our vaccination rates are still lower than the general population.
Yeah, and that's what everyone should be looking at. You know, like you said, it's not you're doing your reverse racism on yourself by not getting it. Because again, if we're the higher number, but we're the smaller population in America. So how is that? That doesn't
and
even.
Let's not just talk about death. I don't know about y'all, but who on here can afford to be out of work for a month, 2 months? You got
That's
5
true.
kids at home. I mean, I ain't trying to be funny. Y'all, we talk about being in the hospital, being dead. Okay, what about long-term effects? I'm just saying. I mean, sister got to work. Sister got to buy some shoes and some earrings.
So are work guidelines changing for that? Do you know work guidelines changing for people who are out with COVID?
Whatever your insurance is,
Okay.
what you're gonna do.
Okay.
And
because I didn't know if that had changed. Yeah.
The empathy level, which may or may not be right, but I feel so bad for you, is getting less, because people unfortunately are saying, yeah, I got my shot, you ain't get yours. Why?
That makes sense. Yeah.
I mean, and that may be wrong or right, because we got to extend grace to everybody. And I'm not demonizing people that are not getting vaccinated. Let me be clear. I'm not demonizing. You get the information. Y'all email me. Follow me on Facebook, Instagram, all that. Email, and I'll give you to the right person. Go to the CDC. I'm not demonizing you, but have legitimate questions and then make the decision. But live with the decision you make.
Right.
Okay? Live with that.
Yeah, that's true. It's your decision. All right, can you, so there's another question that says, can you please dispel the myth that COVID is man-made to eradicate Black and Brown communities and population, and how it is more accessible in our communities?
Thank you for that question. The answer is no, it is not. Because if you think about it, of the COVID deaths, if this is man-made for our community, then why all the white people dying at even high, I mean, as far as sheer numbers are dying just as much. So, I mean, and if it's man-made for our community, you got a past president that had COVID and was half dead. Now you finding out your boy was half dead. And you have other, so no, this is not anything for genocide and whatever. That's a falsehood. And it actually makes little to no sense, because The nation is being vaccinated. We're not saying Black people, y'all get this vaccine, the white people get to this one, Hispanic, no. Whatever you get is what you get, okay? So I'm glad for the question. We know that we have health disparities and health inequities in medicine. We know that. However, in this case, there has been a push, and I've been part of the national push to get us vaccinated and to tell the truth about it. And that is that we need everybody and their mama vaccinated in our community, in the nation, but certainly in our communities. That was
Dr. Shirley, I had a question. I want to elaborate on something you said earlier, where the people over in India would beg, borrow, and steal to get the vaccine, to get the shot. But over here, we like, okay, it's like, okay, it doesn't affect me. I'm gonna keep it moving.com.
I'm gonna keep it moving. I ain't wearing no mask inside. Yeah. You know, I'm good.
People really understood
whatever.
that.
Yeah.
Get that shot. I mean, you got millions of people that love it.
Millions. And let's talk about the motherland. Let's talk about Africa. Let's talk about poor countries that the United States is having to, shipping off some of our vaccines to. And then there's a call for the Biden administration to stop shipping so many out. But we are not one segment. We are not in our own little silo. You travel, you do whatever, and we are caretakers of the world.
Yeah, that's true. You said something about the booster shot, but I wanted to, if you could elaborate a little bit on that, because I saw somewhere and I read that they were saying if you're 65 or older, it's going to be the recommendation for the booster shot, or do you think everybody's going to have to get it?
Let me give the official answer, and then I'll give you the Dr. Sharon. Let me give you the official answer. The official answer is there has been no decision on the booster shot. Now, Pfizer came out today with data on the increased effectiveness in combating the virus and boosting your immune system with their third shot. The data, that data is being collected now, but it looks off the chart amazing. So there is no recommendation yet. However, Dr. Sharon believes, given the data that I've seen and common sense, that a booster, just like you get a tetanus booster, this ain't nothing new. Remember, every 10 years you gotta get a tetanus booster. Again, that it would give you another surge of protection in the middle of a pandemic. And I have to say again, we're launching a major flu vaccine effort. You're gonna need the flu vaccine, and you're going to need to make sure if the booster comes out that we get both of those.
All right, I want to turn it over to our founder and our pastor, Dr. Jazz.
Hi, Dr. Jazz.
What's going on, Doc? Oh, thank you so very much for joining us. This was so helpful. Good to see everybody on the Facebook and YouTube engage. Dr. Sharon, thank you so very much. You know, I was listening to you while I was out there on Facebook and YouTube, and you were mentioning about in order for us to stop this virus, everybody has to be vaccinated. And I thought about the parable that Jesus taught, because, you know, we always talk in the church, folks, they always need a scripture or something like that. And there's this parable in Matthew where there's this man that Jesus said he healed him, he cleaned the house, and the demons left the house, and then they were trying to find another place, and they could not find a place, and they came back to the house and brought 6 more demons with him. You know what I'm saying? And so if we don't put something in the house, this vaccine is going to keep on coming back to our house because it knows we haven't replaced it. So I just want to encourage everybody as much as you can. I know y'all pray about it. And here's what I say. Just put the faith on the facts and not faith on feelings.
Yes.
You know, put your faith on the facts and not on feelings. And our old man taught me, when the facts are clear, the decision will appear. Get the facts. And that's why we brought Dr. Sharon, because she's giving you the facts. You can't get it from your girlfriend and somebody at the barber shop and the hair salon and somebody at the nail tech. You heard their mama said that, their mama said that, their mama said that, their mama said. Get the facts. That's why she has that MD behind her name. All right. She didn't buy that on eBay. Get the facts.
Yes, no.
Right, because when you have the facts, the decision will appear. So thank you so very much, Dr. Sharon. I'm always glad to have you to give us some facts so we can add our faith onto the facts so we can move forward and eradicate this. The Lord wants to work with us. All right, that's how miracle happened. Every miracle in scripture, God always told us to do our part. He said, take the spit, put it on the guy's eye. You go wash in the water. We are in partnership with God to work in making sure that we heal the earth and making sure that we are safe and secure. So thank you so very much, Dr. Sharon. I appreciate it. Thank you, Larry. Thank you, Dr. Jackie, and to everybody who helped behind the scene.
Thank you for having me and trusting me.
Yes, ma'am.
Give good swap bar every day. Oh, Lord.
I love it.
For health tips and life tips, relationship, whatever I feel like talking about. But Sharon Denise Allison Adi, and then on Instagram, Sharon Allison Adi, just follow me. But good information. And I see Dr. Jackie all the time. I'm always talking about something, sending something, and it ain't boring. I don't do boring. Boring is not part of my DNA. So I'm in the struggle with us too. So when I'm talking about weight loss and exercise, I'm gonna go for a walk. After this, another one. I'm telling the truth and saying my demon is chocolate and I'm trying to fight it.
Well, I just want to thank you on behalf of myself because it was your talks. It was our pastor who said, let's do these V talks around COVID that helped me make my educated decision of getting the shot. Because I was on the fence. I was on Pookie them. I'm listening to Pookie them. I ain't getting that because they're going to try to kill me and you ain't going to kill me. No. But when and Pastor said it's so weird when the facts are clear, the decision is so much easier. So you brought us the facts. I the decision, but the decision was clear. So I just wanted to personally thank you from last.
Thank you.
I'm being honest with you. I'm not just saying this. I was on the fence. And because, Pastor did all these V talks around it, it made me more comfortable. It made me put my fear factors aside and say, this is the educated decision that I need to make.
Thank
Dr.
you.
Jackie?
Yes, no, definitely. Thank you so much, Dr. Sharon. Like I said, I follow you. I see everything you're doing. You're always in the facts. And I love that you're real and, you give it to us straight. And that's what we need. That's what we need. And I know a lot of people after one of the older V talks that they, like you said, they made a decision like, oh, well, I'm going to get it. And then they saw our lead pastor. She went and got it. She was an example also to our V. It's like, oh, well, I'm getting it. I have faith in God. I have faith. And I trust that God is leading me in the right direction. Right. And I love that about our lead pastor. I love that about you for always being available. I mean, I literally got you at the last minute, like, I got to be, trust me, I'll make it for you. And I appreciate that you are willing to come and educate us all the time.
Always. I do want to make sure that we pass this information on. Number one, mask. Yes. Go if you got slack, go back. 2, social distance. I'm telling folk in the grocery store again, get away from me. 3, again, make those massive crowds and all of that. We're not ready for that yet. We're not ready for that. And 4, I need you to protect your children. The people in this country that cannot get vaccinated right now are our babies. And we need to protect them. The way you protect them is mask them up, do whatever, but also make sure you are vaccinated. What mother wants to have her child or father in the ICU or even just sick from COVID? And it could be, and you gave it to them. And you infected your child. I can't make it any more plain than that. I can't. It's irresponsible, in my opinion, for a parent to knowingly know that they can prevent getting a virus that they could transmit to their children. The children cannot be 12 and below or 11 and below cannot be vaccinated. Come on and get our kids vaccinated. And I will say this, my 80-year-old mother, who will be 81 in 11, 12 days, 13 days, whatever. When she was able to get the vaccine, I pushed her to get it. There's no one I love more. My babies, which I have a picture with my baby nieces on Facebook today, when they were I'm like, the moment they're 12, get them vaccinated. My older niece at 15, I said, oh yes. She said, Mommy, when can I get my vaccine? This is real talk, and this is what doctors are saying all over the country about our families. So if we're doing it for our families, you have to know that we know the science.
Wow. Wow. So Dr. Sharon, before you close, 3 hot things. Give us your opinion on concerts, amusement parks, and movie theaters.
Well, Aretha getting ready to come out. Now y'all gonna put me on the spot because somebody gonna see me.
All the fair thing. All the fair
Because I
thing.
think I'm gonna have to hear Jennifer Hudson sing on the big screen. Now, I think you need to be masked up, prayed up, bring your Clorox wipes, and make sure that they are socially distanced. No, really, find a theater that is limiting the capacity, or outdoor theaters, or just wait a little bit. Because I'm gonna tell you, if Delta is higher, then I'm gonna stay home. Concerts with large venues, no. 10,000 people, people were out seeing Kanye, 10,000, all of them, you still need to socially distance. I am not comfortable yet. Did you say restaurants? Restaurants I have been in, yes. But again, if I have the option to sit outside, or I have the option to know that the restaurant is seating every other table and all of that. I recently went out the country and I interviewed the hotel before how many people are vaccinated? What's your policy? All of that. And so do your homework. That's what you need to do. But I outdoor, but not outdoor with 50,000 people up on you, right? Just watching on TV.
Makes sense. Well, Dr. Sharon, thank you so much for educating us and giving us all this knowledge. I mean, I got a page full of notes. The Facebook family, thank you all for joining us tonight. It was
follow me on Facebook. I'll friend you eventually. I got too many friends, but follow me.
Follow Dr. Sharon. And Dr. Jackie, thank you so much for helping pull all this together. And I got to give a shout out to Denise. She's going to kill me for this. She's the executive assistant for the Shine CDC. I want to give her a shout out because she's always on point to make sure we can pull this all together. And a shout out to the IT folks. So Dr. Sharon, on behalf of the Shine CDC and our lead pastor, Dr. Jazz, we just want to thank you for always availing yourself to come help us share hope in a negative experience.